PAE is the prostate artery embolization procedure. The condition is BPH, or benign prostatic hyperplasia. So that's enlargement of the gland. Enlargement of the gland isn't dangerous or life-threatening or anything like that, but what it does is it causes lower urinary tract symptoms. The prostate sits underneath the bladder, and when the urethra comes out, with the enlarged prostate, it's going to constrict that portion of the urethra as it comes out. So it causes like lower urinary tract symptoms of obstruction or dysuria or pain. The goal is not to shrink and soften the gland. The goal is to do the procedure so it relieves the constriction of that urethra.
During the PAE procedure, we put a small catheter into an artery in the patient's wrist or groin and guide it to the prostate arteries using X-ray imaging. Tiny embolic materials are then injected into the prostatic arteries. These particles block the blood supply to the prostate gland, effectively shrinking it, which relieves the pressure on the urethra and improves urinary symptoms.
Before the PAE procedure came out, men were given the option of medication such as like Flomax or Tamsulosin, and those medications are, effective for a short amount of time, or they might be ineffective or just partially effective. And so you got like you have like one end of the spectrum is you have medications that, work for a short amount of time, and then you have the opposite end of the spectrum where there's surgery. I actually have many patients who are very happy after the PAE. I've got guys who come in and, they just feel hopeless. They don't want to do surgery. Medications aren't working, they're miserable. And, they hear about the procedure and they're a little bit skeptical, and then they get it done. And they're like, this is the best thing I ever did.